and my practice in Redondo Beach is once a week. The rest of the time, I am up in Westwood or Santa Monica. And I'm very happy to be able to give you some information about the COVID-19 vaccine. Should I go ahead and get started?
Yeah, go ahead.
Okay, sounds good. And please, the presentation's about 20-25 minutes. So if you have questions, you can put them in the chat, and then we should have a good amount of time afterward to be able to go over any questions that people have. We've been able to get through everybody's questions. So what I will say is this is a presentation from UCLA Health, and it was last updated January 22nd, which is about maybe 3 weeks ago now. There is a little bit of updated information, but it's for the most part all still applies, and I'll point out some of the updates. So, what is the best response during a pandemic? As you know, we're going into the 11th month of a global pandemic with the coronavirus. And so far, we have been following the guidelines of the CDC and the California Department of Public Health and the local Los Angeles Department of Public Health. So, the CDC stands for the Centers for Disease Control and Prevention, and they're sort of our national public health department. And we all know that, and I know that you know as ECE providers, that the ways to prevent virus transmission in a classroom is to wear masks, to do social distancing, to wash your hands, and to wipe down high touch areas and symptom screen. So that symptom screening part is very important too, because if anybody has a symptom, a cough, a fever, a sore throat, they should not be coming to a classroom in order to prevent the inadvertent transmission of virus. So vaccines are a tool similar to masking and social distancing in our toolbox to end this global pandemic. What I say about vaccines in the short term, the goal of the vaccine is to prevent people from dying. And these are vulnerable people in our population, the elderly and those with chronic illness. And vaccine is a long-term strategy for ending the pandemic. Um, as you see in the bottom right-hand corner, the reason to vaccinate from a population perspective is because there will be some individuals who aren't able to receive the vaccine for whatever medical reason. And if the rest of us are vaccinated, then everyone is protected from being sick from the virus. And that's called herd immunity. How does the body fight an infection? So we have multiple systems in our body. We have a cardiovascular system that or a circulatory system that pumps blood from our heart to the rest of the body. We have a respiratory system that exchanges oxygen in our lungs. And we have an immune system that fights germs that attack our body. And the immune system works by producing antibodies. And antibodies are what I call soldier cells. They're like cells that fight. And so when a germ, like a bacteria or a virus, invades our bodies, then these soldier cells or antibodies are able to defend our bodies from getting sick. And vaccines play a role in this whole process by stimulating our immune system to create the right antibody, the right soldier to fight the germ or the virus in this case. And what I say is that the vaccines contain the program, like the computer program that programs our immune system to know what to do. How were the COVID-19 vaccines shown to be safe? I know that this is a big question for a lot of people thinking about getting the vaccine. We have a Food and Drug Administration, which is a regulatory body in the US that really oversees the safety of all foods and drugs that are consumed by Americans. And in order to approve a new medication, drug, or vaccine, we have to go through clinical trials. So there's three phases. The phase one, what occurred for the coronavirus vaccine around the end of May. So, in late spring, we entered phase one trials. And so they produced the vaccine and then asked for 20 to 100 healthy volunteers to receive the vaccine or placebo. And this was really to see if the vaccine even worked. Is it safe? Does it kill anybody? Are there big effects of the vaccine? And they do it only on a small number of people. And when we passed out of phase one, then we went into phase two, and several hundred volunteers then received the vaccine, and the scientists started observing them. Are there side effects? And they also drew their blood 2 weeks after administering the vaccine, and they were measuring the levels of antibody that were produced. So, does the vaccine work? Does it program the immune system to produce those antibodies? And then so we entered phase 2 probably, the end of June, perhaps, middle to end of June. And then that phase 2 trial kept going. And then at the end of July, we entered phase 3 around July 29th, and hundreds or thousands of volunteers. So for both Pfizer and Moderna vaccines, about 16 to 20,000 volunteers each volunteered for those clinical trials, phase 3. And now they were really the scientists were trying to see, did the vaccine prevent transmission, or did the vaccine keep people safe from transmission? If people who were vaccinated were exposed to COVID-19, did they get sick from it? Is it effective? What were the most common side effects? And so I think the important thing to say is that there was all these data that were collected from phase 3 trials. They were analyzed in around November of last year. The application was submitted to the FDA, and the FDA had to look at everything, all the data. And as you see, the FDA licenses a vaccine only if it's safe and effective, and the benefits outweigh the risks. So both of these vaccines were approved by the FDA. Was the vaccine made too quickly? No, it wasn't made too quickly. It might seem that way because we declared the global pandemic in sort of the second week of March of last year. And then by May, we had a vaccine. So some people think, oh, wow, they made this vaccine in 2 months. That's too fast. I hear that it takes years to make a vaccine. And the reality is that the COVID-19 virus, the SARS-CoV-2 virus, is very similar in shape to the SARS virus that caused the H1N1 flu epidemic in 2009. So in actuality, what happened was that scientists were already trying to look at creating a vaccine against H1N1, and they piggybacked on all that information that had already been done for 11 years when SARS-CoV-2 came along. In some ways, we were just super lucky, actually, that all that technology had already happened. And then SARS-CoV-2 happened, and scientists were able to apply that knowledge to this specific instance. So it's not that the vaccine was made too quickly. In many ways, we were just lucky, and it built upon technology that had been developed over 11 years. What COVID-19 vaccines are authorized for use? Right now, we have 2. You may have heard in the news that a couple more are hopefully coming online soon. The Pfizer and Moderna are the names of the pharmaceutical companies that made these vaccines. Pfizer, they both require 2 doses. Pfizer was authorized for ages 16 and above, and that's because they did include 16 and 17-year-olds in the clinical trials. And Moderna is only authorized for 18 and above, so only adults, no children, because they only included adults in their clinical trials. As I mentioned, both are 2 shots, and 2 doses, and Pfizer is 21 days apart and Moderna is 28 days apart. Now, during this vaccine shortage, people are asking what happens if you don't get your second dose within this time frame. The CDC at the end of January, because of the supply shortage, have said that you can get up to 6 weeks apart between the first and the second dose. Optimally, they would prefer these days, but because it's hard for people to find a second dose, if you do it within 6 weeks, you should be fine. How is the vaccine administered? It pretty much goes into a muscle. And if you go to any of the vaccine pods, most people will put it into your deltoid muscle. So if you go to the end of your collarbone, at the top of your shoulder, you'll feel the knob of the end of the bone, and you go 2 finger lengths below that. That'll get you right in the middle of the belly of the muscle, the deltoid muscle, and that's where the vaccine is injected. Honestly, when I received both of my doses, I didn't even feel the vaccine go in. The needle is very, very small. And as I mentioned, you have to receive the same vaccine for both doses. If you start with Pfizer, your second dose has to be Pfizer. If you start with Moderna, your second dose has to be Moderna. There's no mixing or matching. Because of the supply shortage, I have heard that scientists are trying to see if mixing is allowed or can still be effective. But as of this time, officially, the FDA says not to do that. How effective is the COVID-19 vaccine? Over 95% is super effective. And this is compared to other vaccines that we have where the technology isn't as good and we get maybe 60 or 70% effectiveness. Here, based on the data of those clinical trials that I mentioned, over 95%. It's very exciting. Scientists, I can tell you, are very excited. It was beyond their expectations. Some people have asked, well, what if what is the effectiveness after the first dose? And what I've heard from my colleagues in public health and infectious diseases is that after the first Pfizer dose, you're about 50% covered. And after the first Moderna dose, you're about 80-85% covered. But after both doses, after the second dose for both vaccines, it's about 95%. How does the COVID-19 vaccine work? So we'll talk a little bit about the science of how vaccines and the immune response protects our bodies. As you see, the COVID-19 vaccine, or the virus, is called SARS-CoV-2, and it is a coronavirus. And corona means crown in Latin. And so you see the circle with this pins on it looks sort of like a crown that you would put on your head. And so that virus enters our body through our mucous membranes, whether it's our eyes, our nose, our mouth, any mucous membrane. And the virus can then circulate in our system and try to attach to a receptor on our cells. And that receptor looks like a Y down on the bottom. And so you can imagine that the pins on the coronavirus, those little knobby things could go into the receptor. And if they bind, if they lock into place, the receptor then draws the virus into your cell and then you're infected, and that can make you sick. The way that the vaccine works is, as I mentioned, the vaccine carries a program, right? Like a computer program that stimulates your immune system to create the antibodies, the soldier cells. And here in this picture, you see that the antibodies are the yellow Ys. And what the yellow Ys do is that they bind all the pins around the virus so that if this virus comes close to your receptor, the pin can't lock into the cup of the receptor because the Ys are covering it. Right? So now this virus is covered with your antibodies and it can't get into your cells, so it can't make you sick. And the more vigorous your immune system is, the more antibodies you produce, so that all the SARS-CoV viruses in your body would be covered and coated with antibodies. Should I be worried about an mRNA vaccine? You may have heard in the news that this vaccine is the first one to use mRNA technology. Again, this is not new technology. This is building upon the 11 years of using mRNA technology. It's very exciting because it's a successful application of the technology. But the mRNA fragment is the computer program. So that is the code that stimulates your immune system to produce the right antibody. So should I be worried? No, there's no reason to be worried. What are the vaccine's ingredients? So you have this piece of mRNA that's like the computer code. So that needs to be in the vaccine. You have lipids that coat the mRNA so it doesn't degrade as it's traveling from the shoulder to your immune system. And then you have salts and sugars and other compounds that sort of stabilize the whole thing so that it can do the job that it needs to do. The vaccine does not contain the virus that causes COVID-19, so it cannot give you COVID-19, and it doesn't affect your DNA. Some of the questions that I've received, I can tell that people are nervous or worried that this is like giving you a mutation because it's mRNA. That is not the case. mRNA, we use such a small snippet of it, and the only purpose of that little snippet is to code your immune system to make the right antibody. It can't do anything else. So it can't affect your unborn baby if you're pregnant. It can't affect your ability to get pregnant. It can't affect your ability to get someone pregnant if you're a male. It's just a little piece of code that stimulates your immune system. And another important thing to know about the COVID-19 vaccine is that it does not contain any eggs or preservatives. Some people with an egg allergy have been told that they can't receive some vaccines because sometimes they use some sort of egg protein derivative in the preservative. There is none of that in the COVID-19 vaccine. So if you do have an egg allergy, you are able to receive the COVID-19 vaccine. Is the COVID-19 vaccine safe? As I mentioned, it's gone through the clinical trials, it's gone through the scrutiny of the FDA. The FDA has confidently said that both Pfizer and Moderna vaccines are safe. They're now looking at the data for the newer vaccines that have been, submitted, like the AstraZeneca or the Novavax or the Johnson & Johnson vaccine. Those are all waiting approval from FDA. But for now, these two vaccines are completely safe because the FDA of the United States is actually quite a conservative entity, right? So it took us a little bit longer to approve these vaccines because they have so many extra checks and steps to look at. Both the UK and Canada went through the process faster, so they started vaccinating a little bit faster. Around the world, the FDA is recognized as being sort of the highest level of safety of any entity. What are the potential side effects to receiving the vaccine? These are side effects that pertain to any vaccine because they're basically side effects associated with receiving something in your body that stimulates your immune system. So as I mentioned, the vaccine is an injection. So there is some discomfort at the injection site as the needle goes into your skin and into the muscle. As I mentioned, it's a super tiny needle. Most people don't feel it, or if you do feel it, it is at the most like a mosquito pinch, like a little mosquito bite. After receiving the vaccine, 6 to 8 hours later, you may start to feel some symptoms of fatigue or achiness, and that's because your immune system is working. Anytime your immune system has been stimulated to produce antibody, you feel that achiness. When you're getting sick with a cold, you feel that achiness. That's because your immune system is revving up. And so these symptoms have generally been mild and in most cases go away after a day or two. After the first dose for me, I only had a little bit of soreness at where the injection went in. After the second dose, the next day I had a little bit of like that fluey achiness for about half a day, and then I was fine. How long will I have immunity after vaccination? This is a really good question. We don't know yet because those phase 3 trials are still ongoing. The scientists plan to follow those patients, those 16 to 20,000 patients in each of those trials for a total of 2 years. So it's only been 6 months so far. So far, it seems like you have immunity for at least 6 months, but obviously the FDA decided that the benefits outweigh the risk because they went ahead and approved the vaccinations for everyone. I hear from my scientific colleagues that they're hopeful that the immunity will be long lasting, like several years. We just don't know for sure. Can I catch and transmit COVID-19 after I am vaccinated? The answer to this question is also we don't know yet. The reason that we don't know is because the trials were set up to determine whether you would get sick, be hospitalized, or die. Like that was the goal. These vaccines came out sort of as the first surge was coming down. There were lots and lots of patients who were sick in the hospitals in New York City. And so the reason for the push was to try to save lives. The way they set up the trials was to answer that question. Now they're going back to trying to look at the data and trying to figure out, are people not only safe from getting sick from COVID-19, but are they also unable to spread the virus if they've been vaccinated? I think that answer is coming any day now. I have heard that the CDC is actively looking at the data, trying to figure it out because, as we reach, 12% of our population here in Los Angeles County with vaccine, then soon you will have groups of people who have all been vaccinated, and maybe some of the guidance can be relaxed for them. But as of this moment, we are all still following the public health guidance that is in effect for everyone, regardless of vaccine. Who should get the vaccine? I think everybody should get the vaccine. What we have now, unfortunately, is a very severe shortage, but eventually the vaccine will be available to anybody who wants it. At this point, the only people who should not get the vaccine is if you have had a severe allergic reaction to the first dose. And so if you do have a severe allergic reaction to the first dose, likelihood that your doctor will tell you not to receive the second dose. Otherwise, pretty much everyone else should be able to receive the COVID-19 vaccine. The benefits far outweigh the risk because we are in the middle of a global pandemic. However, these conditions on the right, if you have any of them, you may want to check with your doctor before you receive the vaccine. I have had lots of questions from pregnant women or women who are breastfeeding. I will say that most OBGYNs have said no problem. And so I have patients who are pregnant or breastfeeding who have received the vaccine. If you are immunocompromised or have cancer or have had a transplant, an organ transplant, then again, you should check with your doctors. But I have also been told in those cases, the patients have received the vaccine. Should I still be vaccinated if I've already had COVID-19? The answer is yes. It turns out that it seems as though the program, the mRNA program, the code, is much more effective at stimulating a vigorous immune response with lots of antibodies being produced than if you got sick by yourself. So you should still receive the COVID-19 vaccine if you had COVID-19 in the past and recovered. Is it better to get vaccinated or contract the virus naturally? The reality is that it's better to get vaccinated because, as I mentioned, the vaccine produces a more vigorous immune response. But what the public health officials are asking is that if you had COVID-19 within the last 90 days, you still have antibodies from your own illness and you are still protected. So in this environment of a severe shortage, out of courtesy, the public health department is asking you to allow others ahead of you in the line just because we are trying to save lives here. And if they're elderly who need to be vaccinated, to preferentially let them get the vaccine first. However, I have also had questions. Is there a problem if you did have COVID-19 in the last 90 days and you still want to be vaccinated? The answer is no. You can still be vaccinated. Why get the vaccine if most people don't die from COVID-19? I think people get this. I don't really get this question much. But in the end, remember that first slide in which we are trying to protect those among us for some reason that cannot receive the vaccine or have not received the vaccine. If we can achieve herd immunity, which is 70 to 80% of the population vaccinated, then we can start to prevent death because the virus won't be able to transmit from person to person. When are vaccines expected to be offered to children? Not for a while. Despite what has been said in the news, there were no pediatric trials of the virus until mid-December. So after FDA approval of Pfizer and Moderna was obtained by the FDA, both of those companies started looking at setting up their 12 to 17-year-old clinical trials. So they started recruitment in the middle of December and they ended recruitment in the middle of January, and they're setting up those trials now. Based on the timeline of the vaccine from last year, we think it will take 7 or 8 months before we have data to analyze, and then they have to apply for the authorization from the FDA. So I think at the earliest, the end of this calendar year maybe, or the beginning of 2022 would be the earliest that we would see vaccines for children between the ages of 12 and 17. And then beyond that, they would have to do it for younger children as well. distribution. Who will receive the COVID-19 vaccine first? Well, this is where this is like the $1 million question, right? So we have a severe vaccine shortage. I do see some, light at the end of the tunnel, in that in the news, they keep saying that, the Biden administration has bought 200 million new doses, and other people are trying to get more hands on vaccine for us. And so I think that in the next few weeks, it will get better, that people will have an easier time to find the vaccine. But while we have a shortage, we have to follow some prioritization guidelines, and these were set by the California Department of Public Health. This is a little outdated in that a couple weeks ago, the California Department of Public Health sort of collapsed the second and the third circle. So phase 1A were the healthcare workers and the people living in nursing homes. We sort of did those populations between the middle of December to the middle and end of January. So now we started working on seniors, and in a week or two, so the state has said that teachers, first responders, and food and agriculture workers can be in the same group as the seniors, but the local counties have sort of separated it a little bit and tried to get seniors first and get them vaccinated or get them a head start, and then are adding in teachers, first responders, and food and agriculture workers in another week or so. So in some cases, they are really looking for ECE providers or teachers who are over the age of 65, so that if you are in that category, you can reach out to Beach City's health district and they will connect you with a vaccine. Those of you under 65 who are ECE workers, I think you'll start to be offered the vaccine in just a week or so. Can I choose which vaccine I will receive? At this point, with such a severe shortage, I'm telling everyone, just take what you get. So when you get to the line, if they offer you Pfizer, take the Pfizer. If you get to the line, if they offer you Moderna, take the Moderna. Because if you refuse it and there is 100 people behind you, it may be a while before you get another opportunity to get a vaccine. Will the COVID-19 vaccine be mandatory? It will never be mandatory by, I think, like the CDC or public health department. I think it depends on your employer, perhaps. But at any rate, because we are still in the middle of a global pandemic, I think it is highly encouraged to get the vaccine so we can get to that herd immunity and protect everyone and end the pandemic. Will I need to wear a mask after vaccination? The answer for now is yes. Because we don't know whether people still transmit, whether they're vaccinated, and we are not near herd immunity yet. The latest I saw in LA County was that we are at about 12%. Then we must continue to follow public health guidelines to keep everyone safe. So we still need to universally mask, social distance, and avoid indoor crowds. Wash hands thoroughly, wipe down high touch areas, and not go places if you have any symptoms. All right. Thank you for your attention, and I'm happy to open it up for questions.
All right. Thank you, Dr. Kuo. Are there any questions from the group?
Katie. And feel free to put it in the chat or unmute. Either way is totally fine.
Go ahead, Katie.
Thank you. So that was very informative. I appreciate all of the information. I know we're eagerly waiting for vaccines for all of our teachers. I did have a understanding vaccinations and herd immunity and things like that. We don't have a crystal ball, but I'm pretty sure we're going to be wearing masks in early childhood because they're the last group to get vaccinated. Is there any scenario where we don't have to end up vaccinating the younger ones because there's so much herd immunity? I don't know. I get the question a lot because some of my parents are like, are we really going to be in masks for another year? And I'm like, yes. So I don't know if there's a
Like
some
your
kind of, I don't know.
So here's the thing. There is not a crystal ball, and I just wanted to address two parts of your question. So when you say that ECE providers are at the end of the line, my understanding is that you're at the front of the line. So I've heard conversations at the Department of Public Health where there are definitely epidemiologists sort of fighting for you guys because you are already in person. And I do think that they're sort of following rubric of vaccine. So yes, teachers will start to be vaccinated, but they want to prioritize higher risk teachers. And to me, all of you ECE providers and any teacher who is actually in person should be prioritized over someone who's Zooming from home. I'm just putting it out there. So I hope that you're not at the end of the line. I'm thinking that you will be near the front. As far as masking the children, that's a really great question. I don't know the way that it will go. It is very possible that you are true, you are correct that because they're not going to be vaccinated, that they'll continue to mask them. However, if all the adults are vaccinated and they're the ones that we're worried about, I could see sort of like an alternate reality where the reality of symptoms in the 0 to 5 population is so low that even if they transmit amongst each other, they don't get sick. And so if everybody who wants the vaccine receives the vaccine by the end of the summer, then we'll have to see what the Department of Public Health comes up with because first of all, I find that a lot of the young children have been very adaptable. So if you did have to wear the mask, I guess it's not the end of the world. But at the same time, it would be nice to see their faces and them to be able to see each other's expression from a developmental perspective. I totally agree. And so I do think there is a possibility that they may say, masks may be optional once herd immunity is reached or something like that. I don't know. A lot of these decisions, I would say they're sort of mainly based on science, but there's like a whole dose of politics on top of it. So
yeah, no, I thank you. So when I meant end of line, I was just referring to the fact that we're one of the industries that doesn't have a union.
oh yeah.
And therefore, like getting us in front of the people who are working from home sometimes is kind of hard. So no, I really appreciate that. Yeah, I know there's no crystal ball, but like, I don't know if there's a scenario where we reach a certain amount of herd immunity that it is safe. So we're planning masking. I tell my parents, like, just like,
prepare. Yeah. No, I agree. I think the question of safe is the debatable point. And despite the fact that you don't have a union, I would say you have strong advocates on your side because I think we recognize that you guys have been amazing coming to work in person throughout this entire pandemic. And, as an essential healthcare worker, I thank you. Yes.
So that was a great presentation because we had Dr. Bill Kim do one last week, which is good. And this is great. And I'm glad this is recorded because I have, a fair amount of my teachers, because they're older, have gotten it. Then I have this group in the middle that is like not anti-vaccinations, but they're going to be in the back of the line, right? Waiting to see what all happens to all of us. But I think this that was so well put and very simple. I want them to see that. But my question is, so if you get a first vaccine and you don't, let's say there's a scarcity and you don't get that second one, what happens after 6 weeks?
Right.
I know there's a 4 to 6 weeks, but what happens?
Right. That's a very good question. I think that the, CDC and other scientists are looking at that question. What would normally happen with any vaccine is that when it becomes available, we just vaccinate you, right? We wouldn't make you start all over. We wouldn't, make you get an extra dose. We'll see. The extra dose might be a possibility, but in this era of vaccine shortage, I don't think so. I think that it's just when it becomes available, we'll just give you the second dose, and then that will stimulate your immune system and you'll go on, it will be fine. That the vast majority of vaccines work that way. I think they just can't say it because they don't know for sure yet. There are also studies looking at whether just one dose is enough for now anyway, during the vaccine shortage. So lots of different scenarios being looked at. What I would try to reassure people is that if you got one dose, you're in pretty good shape, and to not stress out about the second dose, given like the chaos that's going on, to not let that like consume you or whatever. And that when that second dose becomes available, most likely we're just going to give it to you. No, even no matter how long it's been. Yeah.
I have teachers and staff aides that, worry about the allergies and all that. It seems like it's very clear that there isn't much. But when you said any other ingredients in the vaccine, like you said, salt and you said sugar. I mean, if someone's allergic to those things, is that?
Yeah, it's very hard. I mean, so people people's immune systems can be different, and there are definitely people who are extremely, extremely sensitive. And maybe for that reason, like after the first vaccine, they just don't want to get the second vaccine if they have like some sort of, it might not be an official like severe allergic reaction, but it just really didn't sit well with them. And so I think are always going to be a small proportion of people that legitimately just cannot or will not get the vaccine. And so it's important for the rest of us to do that to keep them safe, right? But if there's any issues, they should check with their doctor. Mm-hmm. Yeah, go ahead.
It might be other people. So you said like in a week or so, that daycare providers or early childhood education will open up. And that's why I got a hold of Allie. I just wanted to have some connection to something, because you're right, licensing is not doing that for us. That's what we thought our body would help us be organized. Is Beach Cities, are you guys going to start vaccinating, or is it you're going to maybe possibly connect us with somebody when that door? What I wanted to have is a connection. We know when all of a sudden we see that, we go into the little square that says, okay, it's essential workers and daycare providers. Now we know, where do we go?
Yeah, and I can jump in and answer that question. What I know today, I have to look at the date because I'm sure as soon as tomorrow comes, it might be outdated. That's how quickly all of this is moving. So yes, we are trying to get a really solid count on all early child care providers in the beach cities in the South Bay and what they call a service planning area. That's how the county organizes all of LA County into these service planning areas. So we are in service planning area 8. And so we are looking to do outreach to our early child care providers as well as our school partners in service planning area 8 when the vaccines do become available. I will say a couple recent developments just this week about vaccine distribution. I think as they open it up to the next tier, as Dr. Kuo was saying, there will be some closed pod opportunities specifically for educators, early child care providers, and then the eligibility will also be open to the countywide location. So the megapods that you're seeing, some of the other venues, the pharmacies. So I think our advice to all is take the shot that you can get. And so I think if you're able to get it through one of the county sites or through one of the pharmacy locations or a healthcare provider, or if you're able to access it through one of these closed efforts that we're hoping to organize here locally in the beach cities, I'd encourage you and to encourage your staff to do the same. I think what we're doing now is enumerating, we're counting how many vaccines would be needed in those specific populations, and then also identifying if we're doing one location or additional locations to really make it accessible. And we know the barriers that were in place for maybe some of the 65 plus that we heard around technology or transportation, those might not be the same barriers that we're going to see in the early child care setting or for educators. We know it might be more of a time constraint. So looking at availability of those vaccine clinic hours, making them available in the evenings and on the weekends, so we can make sure we're addressing whatever the latest barrier might be to make it as easy as possible for people to be vaccinated.
And thank you for considering those, because those are really key for not just the idea of our workers being able to get them, but like the logistics behind getting a substitute and then opening up our cohort to an additional person. So there's the financial aspect and there's an additional risk. So I just really appreciate the fact that you guys are considering those. That's, thank you. So.
And I would say too, for any of you, if you have other considerations that we should be looking into, we're open to that. We're in the planning process. And I think all of that information is helpful to know. So if there are other things that we should be aware of as we're kind of mapping this out. And again, there's no crystal ball to know the precise time when that will be, when all of you will be eligible to be vaccinated, but please do send my way.
And then also, so I wrote on letterhead to all my teachers and staff, that they work for us, and I give a facility number. And then I said they could probably use the letter and then a paycheck stub and the driver's license. Would you think that would be adequate? Is there, I mean, how else can you prove,
Yeah, that sounds good.
Yeah, I don't think they've articulated beyond for the other sectors what the requirements would be for confirming you're in one of those categories. Have they, Dr. Quo?
I've heard that like a pay stub or a letter or your driver's license should be enough. If you have an ID badge, then clearly that helps. But if you don't, then yeah, that should be sufficient.
Yeah, the ID, we went with ID badges just because our umbrella organization is a synagogue. So that doesn't categorize us as being able to be eligible. So the paychecks don't help. So we went with the badges and things like that. And Sharon, if you don't have like a huge staff, I'm happy to help. I'll put my info in there if you guys want badges. We just bought the supplies from like Staples. Yep. And we have a little laminator. So I'll put my contact stuff in there and I'm happy to help. So the other concern for us was family childcare providers and, nannies, even though people don't think about those. Those were the other areas that some of the people in my industry are looking at concerns. So.
Any other questions from the group?
Thank you so much, Dr. Quo, for all your information about this. It was just such a good overall snapshot of the vaccine for our staff. And I have recently had some younger staff members who've been asking about any effects on fertility. I know that there was some information out there, probably more on the non-scientific side, but I think that it was very widespread. Have you seen anything or noticed any more stronger evidence about that?
Yes. The studies did include pregnant women. And so there was no problem with receiving the vaccine if a woman was pregnant or planning to get pregnant.
It is a
That has been said by the CDC and the FDA and other organizations. However, I know that that's a very vulnerable time for a lot of women, and they get a little bit concerned. So I think it's something that they should talk to with their OBs. I will say that getting the to weigh the differences, getting the vaccine while pregnant or planning to get pregnant is a greater benefit than getting COVID-19 while pregnant. So I will say during the pandemic, I have had actually doctors who were pregnant who did get COVID-19 either, because they were in the hospitals or whatever. And that the concern, nothing yet with the baby, but we don't know for sure, right? It's not like Zika, but definitely, the choice between getting the vaccine or getting COVID-19, the vaccine is much better than getting COVID-19 during pregnancy. So no impact on fertility. That question does come up, and no impact on sterility for the men. Like nothing with the DNA changes, nothing with the mRNA code in the vaccine changes your DNA. It's not a mutation or anything like that.
Okay, great. Thank you. And then we have our early childhood is connected to a bigger school. Would that be helpful to combine them into one education pod, or to include the numbers together with the lower school and the upper school? Or kind of what do you think is the best way to go about ensuring that our preschool teachers will also be covered?
So your preschool with your K through 12?
K through 8.
K through 8? Yeah, so I would say, so is your K through 8 back in person?
Yes.
Oh, okay. I think whether you combine or you don't probably doesn't matter because you're in person. So, Allie and I know the person sort of overseeing vaccine distribution, and she has told me repeatedly that she wants to prioritize the teachers most at risk. So, to her, that is teachers who are teaching in person. So, if you're teaching in person, she wants to prioritize those teachers over teachers who are Zooming from home. So if everybody in your school is teaching in person, then I don't know the value if you group together or not. If you're all teaching in person, you are equally going to have access to the vaccine.
Okay. So it can all considered kind of a more higher risk,
Correct.
because everyone is teaching in person. Okay,
Correct.
that's helpful. Yep.
Correct.
And sorry, I know that these are all crystal ball questions, but now that the anticipated guidelines are going to be that teachers will be eligible for the vaccine in the next week or two, but there was also simultaneously needing to stop vaccine distribution for the next couple of days. Kind of, what do you think the likelihood of being able to actually have access to a vaccine in the near future is going to be for our teachers?
I think it's going to be good. I talk to the person like every day or every other day, pretty much, who is in charge of vaccine distribution. She's very hopeful that they're going to get almost like a double supply of vaccines in the next week, which is why they're able to allow teachers to go ahead and start getting vaccinated. They're also getting an allotment directly so right now our vaccine supply comes from the federal government, sends it to Sacramento, sends it to LA County. And in the next batch from the federal government, LA County is actually going to get a direct line from the federal government, and their FEMA is setting up a megapod at Cal State LA. So I think, a lot of people recognize that LA County needs to be prioritized of any place in the country right now. We have the highest numbers, highest density, highest cases. So I think people are recognizing that, like, we need more. And so I do think that they seem hopeful. Basically, they're going to start the teachers when they get double what they've gotten now, and they think that's coming in the next week or two. So I think it's looking promising, but like you said, there's no crystal ball. I mean, bearing some, massive problem, but I do think that the spotlight has been shined on LA.
Well, that's good.
Yes, I agree.
Thank you. That's really helpful.
Mhm.
Are there any other questions for Dr. Kuo? All right. Well, I want to thank you all. I want to thank Dr. Kuo. I always learn something new from her. She's been on a bit of a tour doing these at various sites all over. So I want to thank her for her time. If you have any additional questions, you can reach out to me. I put my email address in the chat. We will be in touch about next steps, also sharing more information about COVID health and safety. And then I also put in the chat, as Dr. Kuo had mentioned, the Department of Public Health is partnering with Children's Hospital Los Angeles to do a closed pod for early child care 65 plus this weekend. So if you have any employees who are in that category who haven't been able to access a vaccine elsewhere, please do have them reach out to me. I just need a name and a phone number for them to get them signed up for the Saturday clinic. So we'll send that around to the others who weren't able to join us here this afternoon. And I will also provide the recording according to the full list that we had originally done outreach to. So if there's any other feedback that you have as we move through this process or considerations, please do reach out to me or my colleague Tammy. She'll be leading our early child care outreach moving forward. So thank you all for your time and enjoy the rest of your evening.
Have a good day.
Thank you.